How is Phoebe?
She's good. I've had her for 2 weeks, and they said she was 10 weeks old when I got her, but I don't believe that's true.
Okay.
I think she was younger than that.
Yes.
But she's done very well. She's very social, and she plays, she sleeps, she eats, she drinks,
Sure.
and like I'm actually really pleased because I know that it doesn't have to be that way.
Yes. Yeah. How have you got any other cats at home with her?
Well, a long time ago.
Okay. So no.
But my daughter's a cat person, so she's holding my hand.
Sure.
Kind of leading me on.
No health issues since you took her on?
Nope.
And when did you come over to the island then? When did you come over to the island?
Oh, I got her on the island.
You got her on the island? Okay.
Yeah. I got her in Parksville.
Parksville. Okay. And no coughing or sneezing since you took her on?
Nothing.
Come on.
Like she seems perfectly healthy, but
Yeah.
I know she needs her shots and she needs to be dewormed.
And do you have a rough idea of her age?
Well, they told me 10 weeks. I don't think that was honest because she was awfully tiny.
I don't think it's far off. Probably.
Well, that would make her 12 weeks now.
Yeah. So she's had no vaccines?
Nothing.
1.76 kilos. Which is a good body condition. I've no concern with her there. Good weight and size.
She poops and pees regularly. And,
Good.
Yeah.
What are you giving her for food?
Well, I was hoping I'd remember the name of it. It's something I got at Bosley's because I kind of got everything at the same time. It's a young kitten kibble.
Mm-hmm.
And I started wetting it down, and then after about 1 week, she stopped eating it, so I started giving it to her dry, and she seems to prefer it that way.
Sure.
But she does drink.
But it's definitely kitten food then.
Oh, yeah.
Could I get you just to hang on to it here a second while I'm just going to have a look at a few things. I think you're right there.
Yeah.
Hey,
Phoebe.
Just want to make sure that she's got ears and eyes here. It's difficult to do that on one's own.
So she was the only kitten like this.
Mm-hmm.
The others in the litter were all black.
Right. Okay. Let's have a look. And you said you had no flea treatment or deworming or anything like that?
She said nothing except love.
That's what we need. Well, deworming.
She's a wild one. She's got lots of energy.
Just gonna try and get on her level here. Let's have a look at that. Just nice and still. Good go.
For a few days there, I was concerned I may have maybe her dad was feral or something.
I mean, kittens are always a bit crazy, so it's sometimes hard to know that for sure.
Yeah.
She certainly seems quite socialised, obviously.
Oh, yeah, she definitely is.
Let's have a listen there.
You're okay. You're okay.
Let's try all over this. That might be a bit easier. Oh, wow.
And what age do you recommend they be spayed?
Yeah, I mean, 6 months is the sort of traditional time frame over which we do that. Some people it's slightly earlier depending on weight. And she is 1.7 kilos. The minimum we want to see them is about 2.2 kilos for spaying, but and most kittens will hit that around about 5.5 to 6 months. But anything much after 6 months, and you run into risks of unwanted pregnancies and things, which if we are if that's the aim of getting a spayed, then that's probably when you want to do it. Is she likely to be indoor cat?
Yes, definitely. I live at, no, she's not allowed to be outside.
Right. I see.
Not that I would let her outside anyway, because we live in a wild country. Feel like we're feeding cougars and raccoons.
Yes, there has been that comment made by other people.
Yeah.
I mean, kittens are always, if they're outdoors, they're always at the highest risk of injury and things. So,
Yeah. We've lost, my daughter's lost a couple of cats that way, so.
yeah. I mean, she certainly seems very healthy. I have no concerns about her in that regard. Very, obviously, very curious, and the chest sounds fine to me. Her skin coat looks good. I think you would see evidence of fleas and things on her if there's that. I will check her in a moment for that. She doesn't have any evidence of ear mites or anything of that kind.
I did notice you scratching her ear, but
Yeah, I mean, I don't see anything in there.
no.
It is a good idea to get them some parasite control at this stage anyway.
Yes.
Because they can have lots of unwanted things developing. I'm going to give you a dewormer to give her if that's okay.
Yeah.
And then a topical external parasite control called Revolution, which does fleas, ticks and mites. And then also we better get started on some vaccinations.
Yes.
So the usual 3 vaccines that we give to cats are rabies, leukemia, the feline leukemia, and HCP or upper respiratory viral complex.
Yes.
The upper respiratory viral and leukemia are probably most important right now. She's maybe slightly too young for the rabies, depending on her age. So we'll do.
Does she still need rabies
We'll
if
do
she's
that next
living
time.
indoors?
I would recommend it. Yeah, I mean, what are you doing under there? Under there. The risk is low, very low, in Western Canada and on the island. In general, rabies is not something we encounter very much. It is in the bat population, however, and strangely, you end up in a situation where actually indoor cats sometimes can be at not necessarily higher risk, but I've seen a number of indoor cats that have caught bats that the owners didn't know were in the house.
Oh, you're kidding. Well, I don't think there'll be bats at Berwick.
Sometimes they just appear with a bat in a house, and you're like, where did that come from? And any interaction between bats and cats does carry the risk of rabies, because the prevalence of the disease in bats is probably about, it has been estimated to be as high as 6 to 10%, which is extremely high. Having said that, we don't see many cases of it, so I do recommend it. There is a difference between never having had a rabies vaccine and having at least had one in your lifetime.
One in your lifetime, yeah. I think my dogs have had at least one.
I would certainly recommend one at this stage, and then because we don't know what's going to happen in the future.
Yeah.
And then, say leukemia and HCV vaccine, I definitely recommend getting those. They're both given as multi-stage vaccines, so you need to have a booster in a few weeks' time.
Okay, so they're not all given at once.
Those two, so HCV and leukemia will be given today, and then back in a few weeks for a booster of those, and that's a good time to do a rabies shot as well. So we'll do that then. Okay. Does that make sense?
Yeah.
Yeah. You have any questions about anything in that regard, or anything else you wish to ask about?
No, just deworming.
Yeah. So the dewormer I'll give now is a Milgamax, and that's a very, very effective tablet.
Here. This is so patient.
Sudden kitten.
I want a sudden kitten.
Thanks. I like taking off for days
With no planning, which is not possible when you have a pet. That's really cute.
Oh, he just shoved it in Lori's face and then walked away. Lori was in the middle of something.
That sounds like crazy.
He's like, sudden kitten.
Isn't that a nice thing to do?
Sudden kitten attack.
Alright.
Have fun.
Pop it in.
You want water?
Yeah, she takes it.
The cutest.
Why are you so cute? Your dad's kind of a jerk.
No. Maybe it's quite a big one for this kitten, actually.
Then break it in half. Very nice. He was
That cat.
Oh. Yeah. So he literally told Daddy he didn't have time for her smile today.
That's it.
Rude, hey?
I know.
Oh.
I don't inject you. Hold on.
That'd be lovely.
Ah,
Yay! Your heart went really, really fast.
she's good to go.
Where's she going? In your room?
2 to 3, 2 to 3 weeks time for second vaccination.
Okay. Good job. Do we have a little kitten that belongs in here?
Did she make a fuss?
No, not at all. She did really good. She swallowed the pill, no problem, and took the vaccines like a champ. So she'll be due for booster vaccines in 3 to 4 weeks, and we can make that appointment with the girls up front.
Okay.
There you go, my love. Okay, and then did you want to hand out with her at all?
No, I can manage.
You're good? Perfect. I'll meet you out front then.
Okay.
Thank you so much.
All right.